Shingles only occurs in people who have had chickenpox. When a person gets chickenpox, the immune system is able to eradicate the virus from all but isolated nerve clusters called ganglia. If the immune system is intact, it can keep the virus in a state of latency, dormancy, for decades at a time. Shingles represents a breach in the body's immune defense during which the virus can spontaneously reactivate and cause disease. The causes of reactivation are many and include aging, characterized by the progressive decline of immune function, acute or chronic illness, psychological stress, immunosuppressive therapies, compromised immunity, such as occur with cancer or advanced HIV. Older age is arguably the single greatest risk factor for shingles. While the lifetime risk hovers between 20% and 30%, the risk increases dramatically after the age of 50. By age 85, the lifetime risk is no less than 50%. Even so, shingles can affect people under 50, and there is often no rhyme or reason as to why some people get it and others don't. This is especially true with respect to oral shingles. Some studies suggest that males are 70% more likely to get oral shingles than females, although it is unclear why. According to the Centers for Disease Control and Prevention, CDC, around 1 million people in the United States are affected by shingles every year. Is oral shingles contagious? Oral shingles is contagious. If you have any type of shingles, you can transmit chickenpox to someone who is not vaccinated or has never had the disease. Shingles can only be spread by direct contact with the blisters. Avoid sharing food or drink and kissing until your blisters have healed. If you have shingles blisters on other parts of your body, those are also contagious until they crust over. Shingles outbreaks can take up to 5 weeks to fully resolve. With the early initiation of antiviral therapy and the appropriate supportive care, resolution times can be cut significantly. Without treatment, the time between the eruption of a blister and the onset of healing is 7 to 10 days. If antivirals are started within 72 hours of an outbreak, the time can be cut to 2 days. Moreover, the severity and duration of the outbreak can be reduced. By way of example, studies have shown that the early initiation of Valtrex can reduce the duration of shingles pain by 13 days, compared to no treatment. Although antivirals can significantly reduce the severity and duration of a shingles outbreak, there is little evidence that they can reduce the likelihood of post-herpetic neuralgia. Age, rather than treatment, appears to be the single most influential risk factor in this regard. A 2014 review published in the Cochrane Database of Systematic Reviews concluded with a high level of confidence that Zovirax does not significantly reduce the risk of post-herpetic neuralgia in people with shingles.